Hi everyone, this is Kate Warnock coming to you live from MediFuture. I'm GuideWell's social media manager, and today in the GuideWell Insights Lounge, I'm so pleased to bring you Miss Donna Owens. Donna, welcome.
Thank you. I'm glad to be here.
We're happy to have you. So Donna is the city administrator for the city of Niagara Falls in New York, and she is one of the Wellville Five. So we wanted to make sure that we got to hear from you. We're so glad that you're able to share your story with us.
I'm glad to be here.
So Donna, the Wellville Five is a project started by Esther Dyson, the founder of HICCup, and I know that what that did is it kind of canvassed the entire nation to see which cities had health programs in place that was really there to help make a change in your population's health. What is it that the city of Niagara Falls had that Esther saw as the right fit for you to be one of the Wellville Five?
I think that what she saw was a city working to change its health culture, working together collaboratively. She saw the collaborative relationship that we had with many of our stakeholders. Our mayor, Mayor Deister, a part of his vision for the city was to go outside of the infrastructural things and the municipal responsibilities that mayoral leadership is required to do. He looked at the quality of life issue of health, and he said our most valuable asset in our city are our people.
Right.
And he wanted to make sure that all of our people had access to care and that we were doing what we could as a city to become a healthier, more viable city, and one of the most healthiest in the nation.
Well, that's an esteemed, what a wonderful thing for him to get behind. I know you just started in this program, but I'm wondering, can you share with us any early successes you may have had so far?
Some of our earlier successes was to just build this coalition of people. We have over 40 agencies working together at the table. We started back in 2009 with a National Urban Fellow that was sent to our city, which was a nurse, and she helped pull together all of our stakeholders to talk about, to have the conversation about health. Once she got there, we started looking at the community that was right around City Hall. It was like a 4-block radius in which we looked and saw that there were a lot of social determinants that were affecting people's bottom line and their health.
Sure.
So we started canvassing the community, talking to the residents. And once we did that, we found that some of the residents said they didn't go work out, they didn't run or things because there were other social issues that were in their community, such as crime and the streets weren't lit enough and they didn't feel safe. So we started working on those things in the community. We built a community park. We did a whole bunch of different things based on community engagement and visioning to bring everybody to the table to focus on the things that impact your health and make your community a stronger community. So the city started pooling its resources and really focusing on those things that strengthen that community that would allow people to feel safe and want to come out and engage in the health.
So tell me about the community response. How are they taking all of these measures that their city government is taking to make their lives healthier?
They've been very active and very engaged. We're able to identify community leaders. We work with the community block clubs. We work with the faith-based community, the churches. Some of our stores, our grocery stores, changed over to more healthier foods. We've did a thing where we had, for how they do restaurant week, we ask all the restaurants to put a healthy food item on their menus. So it's been well receptive.
Right.
The university, Niagara University, was very much involved with us and at the table. Our two neighboring, our hospital, we have one hospital in the city, and then a neighboring community had another hospital. They were at the table with us. So it's been a growing process, but it's been a very, very good collaborative and an active driven process. So those relationships are growing stronger, and once we became a part of the Wellville Five, we now have those other 4 cities that were selected now as a part of a collaborative and a coalition now that we can work on. Either, some of them are rural cities, some of them are towns. We can all come together now around wellness and set a model for the country.
So I understand that here at MediFuture, this is the first time that you got to be with those other 4 cities.
Yes, we just
and that must have been such a gratifying experience meeting the others that are coming from the same place that you are with this focus on health. I wonder, have you learned anything from the Wellville Five that you think you're going to take back to Niagara Falls and maybe apply to solve a challenge that you faced at home?
The thing that I've learned is that we have the same issues, you know, either we're rural or, you know, we're small in number, but we share the same issues. And the best practices we can learn from one another of how we keep people working together and how we engage the community where they are, and how we collectively can lead change that can set a national model. So that's what I'm learning so far. And the willingness of people to work together is just unbelievable. You know, even though it's not your city, it's not my city, it's whatever, it's our world. And so we see that and we want to work together.
Well, I think that that's such it parallels so much of what I've heard here at MediFuture with our other interviews. It really is, you can't do it all by yourself. It really does take collaboration with various partners from across the spectrum of industry and private and public sectors to make that impact. So, you know, at MediFuture itself, have you had an aha moment?
I've had many.
Oh, you want to share some with that?
I have many. I really, it was just seeing how medicine and health has changed, and how technology impacts the bottom line, and how proper use of vision and leadership, how you can, you know, work together to make those changes. The aha moment is that we really have an opportunity to not only learn new things, but to teach new things as well. You know, on the other side of the table, I'm not a techie, so I was like, everything was aha to me. You know, seeing that you can monitor all your biorhythms and how those things impact, you know, your life and your health, and how people are really sitting down and thinking about innovative ways to do old things new ways. But also how they're thinking about how it not only impact on a financial level, but just how it impacts in giving quality care. So I was really pleased to see that there are people that are in the medicine profession and the health profession that are looking to work with communities and making the nation healthier, and making the world healthier. So I've had a lot of aha moments and a lot of things I'm excited about. You know, I told them we would be the pilot for everything. Come in and bring it in.
That's
you know?
That's right.
But they were willing to hear what we needed as well. And how they would work and partner with us to build stronger and healthier communities. So this was a wonderful experience and has been a wonderful learning experience for me. And it taught me that everybody leads. You know, we all have something that we can share with one another, but we are all ultimately in control of our destiny. But we have to know what that is.
That's right.
And
That's
define
right.
it for ourselves.
Well, I think what you've done here is really help to put the real face to what the challenges are. You know, you represent a population that you know exactly how you need to solve, or what the challenges are, but maybe the solutions are a part of what you're bringing back home to tackle those challenges.
And you know, Niagara Falls is one of the world's most famous addresses. Everybody knows Niagara Falls, but we want them to know Niagara Falls as being one of the healthiest cities as well. And I want to thank Esther Dyson and Rick Bush for really coming and bringing an opportunity of creative thinking and being able to connect us and all together, that we can become resources to one another. You know, so I just, it's a great way, as being a public servant, to go back and look at how we municipally manage our resources, but we continue to find other ways and innovative ways to elevate that responsibility and those resources to affect a greater population of people.
Well, Donna, I can tell just, you know, you're passionate about what you're doing,
very much so.
And I know that in the position you're in, you are going to propel Niagara Falls to be one of the healthiest cities in America, and I think as part of the Wellness Five, you will be a leader, and I'm so grateful that you shared your story with us today.
Thank you for the opportunity.
My pleasure, coming to you live from the GuideWell Insights Lounge. This is Kate Warnock. We'll be back with you soon.